I'm Matthew Rettig. I'm a physician at UCLA Medical Center, and I'm the chief of oncology at the Associated VA in West Los Angeles. I'm the medical director of the prostate cancer program at UCLA, and I have a large program in clinical trials for prostate cancer, as well as a laboratory that is aimed at identifying better therapies to manage patients with prostate cancer. My research, in collaboration with other prostate cancer researchers, is based upon a recent understanding that certain genes are mutated in prostate cancer at a fairly high frequency. These genes are the same genes that cause hereditary breast and ovarian cancer, the so-called BRCA1 and BRCA2 genes and related genes. What we now know is that up to 25 to 30% of patients with advanced prostate cancer harbor mutations in these genes. And interestingly, half of those patients were born with the mutation. This has important implications not only for the patient, but for the patient's family. If a patient harbors a mutation in the tumor tissue, we can then test the non-tumor tissue, like blood or saliva, in a very simple test to screen for mutations in these genes. And that's what we're trying to do in my research, is to look at saliva, a simple swab of the inside of the cheek, to detect these mutations in the BRCA1, BRCA2, and related genes, so that we can identify prostate cancer patients who might be better treated with more focused, targeted therapies, as well as identify family members. And a family member of a patient who was born with the mutation has a 50-50 chance of actually having the same mutation. Of course, this is quite high, and it's important to identify those family members and those family groups that might harbor those changes, so that we can perform appropriate screening and treatment for those patients who have the mutation. We're really talking about precision medicine, and in the cancer world, we call that precision oncology. We're precisely identifying the right treatment for the right patient based upon a clear and unequivocal genetic understanding. And this is really how cancer treatment and prostate cancer treatment is moving forward, and we expect this to grow exponentially in the years to come. The money that you provide goes specifically to the sequencing of those genes that are related to BRCA1 and BRCA2, and in so doing, allow us to treat patients more effectively and counsel family members about their risk of these various cancers. So what makes me particularly optimistic right now about this kind of funding is that it breeds team science, researchers working together from different fields, from different institutions, and making advances that directly impact the management and the outcome of patients with prostate cancer. This is critical. This is not doing research for research's sake. This is doing research and understanding the drivers of cancer that allow us to make decisions about treatment in real time that affect real patients with prostate cancer whose treatment options would otherwise be limited by what is available and not have the opportunity to leverage the understanding of the particular genetics of their cancer.